Hey guys, my name is Octavie and welcome to this series where we're going to be trying to make medtech easy. Today we're just going to look at what medtech really is, why it's being applied to every single element of medicine, and what it's going to mean for us in the future. We can divide the applications of medtech into all of the ways that we approach the patient. First and foremost, in preventative medicine, we can use med technology in order to design, make and distribute vaccinations, for example, like during the pandemic. Another way to approach this is in diagnostics. How can we find people that have got a disease or a medical condition more easily? Screening tools can be as simple as the ultrasound scan that you get when you go and see if your baby's okay during early pregnancy. But we're developing newer and more complicated techniques that allow us to test DNA, for example. New genomic medicine tests can look at your DNA and see what diseases you might be more at risk of in your future life. In terms of treatment, there have been lots of technological advancements too. There's flashier things such as robot-assisted surgery, but there's also new approaches that we're devising and that we can train surgeons using virtual reality. Virtual reality can also be used by stroke teams to aid in patient rehabilitation and hopefully stop them representing with any falls or complications because of their stroke. We're also able to use technology to help monitor conditions outside the hospital, and we're moving towards this era of digital health where we can either have patient consultations online or we can devise applications that really help people monitor their health from home. To really start improving medtech products, we need to think outside of the clinical environment. Working with designers, engineers, marketing teams, distributors, we can really implement the best tools on a global scale. Let's walk through an example where this has been implemented. Historically, those suffering with type 1 diabetes or insulin-dependent diabetes had to do finger prick glucose tests. So a sharp lancet was used and then you would test it using a small machine on a strip of paper. It would give you your blood sugar level, and then based off of that you would adjust your insulin dose, you would adjust your carbohydrates in your meals, etc. So it's really critical for diabetes outcomes. However, people weren't doing it. And they weren't doing it because it was painful, because it was tedious, and it just wasn't convenient. With less and less people testing, outcomes got worse. Glucose levels stayed high chronically, and it led to all of the secondary complications of diabetes. So a solution had to be devised, and a small device was designed to sit underneath the top of your arm, underneath the skin, that would measure capillary blood glucose, and you could do it every single time you opened an app and put it on top of the patch. It's easy to see why this patch became so popular, because it has the same amount of pain as one fingerprint test, but only every 2 weeks instead of multiple times a day. And because of it, outcomes have improved. So medtech will represent the future for us as medics and the future for all patient groups. We're going to have to start training in it as medical students and as junior doctors so that we know how to apply it, and we're also going to have to learn how to train patients in using different apps and different techniques that can help them with their own health management. In this series, we're not just going to consider what we need to do from the medical side of things. We really want to gain a perspective on the design elements, the engineering elements, all of the computer science that might go behind it, and how that can help us advance medicine using technology. There's a lot of information to go into for every single point in this video, and that's exactly what we're going to be doing over the series. By the end of it, we hope you understand from conception to development to implementation how a medtech product is made and all of the different elements that go into it and all of the areas of medicine they could be applied to. Thanks very much for watching. If you want any more content or any information about where medicine and technology collide, just look us up at MedTech Easy on all social media platforms.